Well, it's that time of the year. You need to make your appointment for your annual physical. Visiting the doctor this year might be better. Dr. Martin Solomon from Brigham and Women's Hospital is joining us with the 5 reasons why. Nice to have you with us. I know there's a new trend in medicine and family practices, so let's get right to that. What's new as you visit your primary care physician this year?
Well, there's been a tremendous effort to try to focus care more around patients' needs and maintaining health long term. So the new model is the patient-centered medical home. Most primary care practices have been incented to become patient-centered medical homes. What that means is that care is focused on the patient's needs and understanding. We try to be comprehensive, coordinate care across all aspects of patients' health to be sure that care is accessible and available and the quality is maintained.
So everything would lead back to that primary physician. The primary physician would be the one in charge with this home-based care at the doctor's office of getting you the specialists you need, the help you need, but then it would come back to that primary care physician in terms of results and what else is needed as we watch that patient go through an illness or some type of treatment?
Well, not just the physician, it's actually all the providers are working together in a team. The usual team will include medical assistant, perhaps a nurse practitioner,
Sure.
Physician's assistants,
Yes.
social workers, pharmacists, everybody working to try to reach out to patients and achieve a higher level of care.
Well, that's what it seems like, a major effort to cross all the T's and dot all the I's and make sure everybody is on the same page when it comes to dealing with patients. So what does comprehensive care cover this year?
Well, comprehensive care means really looking at health maintenance, being sure that all of the necessary immunizations, preventive procedures are done, to be sure patients understand their medication, there's no confusion about what they're getting, that there's an accurate checklist of diagnoses and a plan for trying to correct things down the road.
You know, I think it's important we talk about social issues that patients really need to be sure they talk to their doctors about. Isn't that something, especially now, you've got to make sure the doctor's well aware of everything going on around you and surrounding you?
Well, in the patient-centered medical home, which is the new model, we have social workers as part of the team that meet regularly to discuss patients' social needs. We can address issues of cost, of living standards, of safety at home. All of these issues can be addressed, and now we're bringing mental health issues into the team as well.
So important. What are the important questions patients should be sure they talk to their doctors about and ask when they have that annual visit?
Well, I think the most important questions relate to, am I up to date on all of my health maintenance, my immunizations, mammography, bone density, colonoscopy, everything else that needs to be done. And I think the very most important question that a patient needs to ask at the end of the visit is, what can I do to make my health better this year?
You be part of the team as well as a patient.
An essential part of the team.
Dr. Solomon, thank you for such great information. Appreciate you
pleasure.
spending some time with us this morning.